Good morning, everybody. Hi, it's Becky with Rochester Mom. And again, I'm joined by Dr. Melissa Richards, the chair of the Obstetrics and Gynecology Department at Olmsted Medical Center. Good morning. How are you?
Good morning. Good. How are you, Becky?
Good. Thank you so much for joining me. This is our third in the series, Let's Talk. And we're talking about women's pelvic health, fertility, concerns, knowing your body, all kinds of good stuff. And today's topic is age and fertility. We do want to stop and we want to let people know that are watching that we are going to be talking about content, or we're going to be talking about content with age and fertility. So if that's sensitive to you, we wanted to let you know about that right away. But we're going to just launch right in. We asked a question to our Instagram community a few weeks back. We said, do you think about age and your fertility? Just a question. 73% answered yes. What do you think about that?
I think you are doing really good polls. I think, it's definitely something that I see in the clinic setting, and I definitely buy that story. We
Mhm.
see that especially when we're looking at our patients, whether I'm seeing them for an annual exam, heavy
Mhm.
periods, or an acute visit. When it's part of the conversation,
Mhm.
yeah, age is playing a role in how people are thinking of their future fertility.
Mhm.
I also think we just have so much more control over our fertility, which is
Mhm.
great.
Yeah.
So that gets to be a conversation where maybe generations before we weren't able to do that. So that's great. I love it.
Right. I know. And what stuck out to me the most is 73%. I mean, that's a huge majority. We need to be talking about this more.
Absolutely.
So I'm really pleased that we're talking about it today. So we're just going to ask some real frequently asked questions related to age and fertility, and also
Mhm.
pepper in a couple of things that readers had to say too. So first things first, how does age affect fertility?
So we do know that in fact it does affect fertility. We're humans or Homo sapiens, like we're mammals. So when you look at what we'd expect throughout our fertility lifespan, our highest fertility chances of becoming pregnant are in our 20s, and as we get into our 30s, fertility expectations do decrease. And then around 45, that's really where we see fertility. Every once in a while, we'll have that patient who spontaneously becomes pregnant after age 45, but really the numbers diminish as we work our way into menopause. The average age of menopause, when you start going through the symptoms of not ovulating, is 51 to 52 years old.
Mm-hmm.
So in your 20s, your chance of getting pregnant every month without protection, having sex during those times of ovulation are about 1 in 4. And then after age 35, it goes down to about 1 in 10. And then, as I said, 45, it becomes much more difficult. But it does
Mm-hmm.
happen, definitely.
Gotcha.
Mm-hmm.
Now you mentioned the age 35. This is a keystone
Mm-hmm.
age, because that is when a woman would be considered geriatric for pregnancy. What does that mean, and what does it not mean? And geriatric is
Exactly.
kind of a big word.
That sounds horrible, right?
Yes,
Let's be
right,
honest. Like when someone
right.
tells me I'm geriatric,
Sounds bad. Yeah.
right? I had my first child when I was 30, and my second just under age 35, and so those words like geriatric get thrown around. Another, what's considered maybe a little bit more acceptable, is using the term, the label advanced maternal age. So
Advanced maternal age.
it sounds a little bit nicer, or
It
AMA.
does. It does. Yes, it does.
So you'll see us, especially in our clinic, we don't use that term geriatric. Doesn't get thrown around. We AMA, like, oh, an induction of labor for AMA, or
Mm-hmm.
we're doing this testing or genetic testing for AMA. So you're not going to hear us throw around that word geriatric. When it
Mm-hmm.
comes to coding, that's a code, or maybe you'll read it in books. So
Mm-hmm.
um, it's that idea at age 35, a couple things are happening. As I said, the chances of becoming pregnant decreases. We see that little change at age 35. And then also, as we get older, with pregnancy, more risks during the pregnancy. We're paying more attention to certain things after age 35 during a pregnancy that we're not noticing as much in our 20s or before age 35. Mm-hmm. Do you want me to go into those a little bit? What to expect?
Well, you can if you want. I just think, 35 is kind of that, I don't want to call it magic number, but that is a number that we really have to keep in mind when we're thinking about fertility.
Yes. Yeah. And the other thing we start thinking about, not only becoming pregnant or during the pregnancy, but another big topic of conversation would be genetics and concern for some sort of chromosomal abnormality, or the chromosomes not being as we would expect them for the pregnancy. We do see a little bump at age 35 too. So it's just important. What I love about us doing this, just right off the bat, is when we talk about fertility, oftentimes there's this feeling of like loss of control. Is a really good way to put it, especially those who are maybe waiting even for their first pregnancy until after age 35, is oftentimes you had control, right? There's a reason you're not pregnant at age 35, because you made that decision. So it's just important for you to feel like, okay, I understand this. I understand, what to expect, the risks, the benefits, all of those things. So yes.
So really good point that you made. I mean, that's true. We're in control, and then until we're not. So that actually leans into another really great question, which is, what is a reproductive life plan? What does that mean when women and care providers are talking about that?
Right. And this is really good. Becky, full disclosure to the listeners out there, Becky and I were talking about some of these questions beforehand. And I was like, reproductive life plan? What do you mean about, and it's one thing I think we should encourage people is the American College of Obstetricians Gynecologists actually has this awesome fact sheet or website about fertility after age 35. And one of those questions is the reproductive life plan. And once again, we have such an opportunity right now to make decisions on how we want to use our reproductive capabilities, which is awesome, right? It's great. So I talk a lot to patients and outside of medicine, just family members. When you're asking someone who is the hot topic is when someone gets married, when are you going to have those babies? Or you've been married for a year, when are you going to have those babies? I can guarantee you that about 95% of whoever you're asking is either on some type of birth control or controlling, whether that's hormonal, non-hormonal, or they're actively attempting to get pregnant, or they are pregnant. So the idea is people already are kind of making their own reproductive plan, but it's really deciding what makes sense. Not only you got to think physically, you got to think mentally, and you got to think socially, what makes sense. And then you also have to embrace the fact that your reproductive plan might be this, and it's kind of like jelly. It can change, and what makes sense today you might have to pivot on that reproductive plan. But it's good to have an outline. Maybe that's a better way to think of it. Like, what's your outline?
No, that's really great. But it's just like putting thought into what it looks like in reproduction for you. And it's funny that you mentioned that it can change a little bit. That sounds very similar to what we hear when we make our birth plans. You can have your idea in mind, but it might change. It probably will change. So we've talked about a little bit about age and fertility and how it affects the eggs, and reproductive life plan. What are the chances, and what are some of the risks? We talk about this as women get older. And it is important to say that the risks do go up as well. And so what are the risks of reproduction
as we get older, right? Yes. So I think it's been a really interesting time for me to be even in obstetrics and gynecology, because we have seen even in the last 15, 20 years, this shift with our patient populations getting older. I just shared I was 30 and 34 when I had my 2 kiddos, and if I was my parents right now, I would have a sophomore in college, and all my kids would be in high school, right? So things have changed. So we do know, all of us, whether we're pregnant, not pregnant, male, female, whatever, as we get older, we pick up medical comorbidities. Other things happen, right? So as we get older, we increase our chance of diabetes, and we increase our risk of high blood pressure. And pregnancy in general has this way of showing us what we might expect as we get older, including women who are older after age 35 have a higher rate of having high blood pressure issues in pregnancy. They have a higher rate of diabetes in pregnancy. And so we know those things. We screen for those things. We're paying attention. We talk about symptoms. But we also, knowledge is power, and it's important for us to have, okay, all right, we're 35, we've got blood pressures right now that are creeping, but we also have a good management plan to keep you safe in your pregnancy. So that's probably the biggest thing. It's just with age, we pick up more stuff, more life happens to us. But it's definitely changed how we manage our OB patients. Definitely just trying to keep everybody safe.
I liked what you had said. Again, the theme of so many of our videos, and something we say a lot, is knowledge is power, and so it's not something to be afraid of, but it's something to know about. And it sounds like, OMC is fully equipped and ready to support patients in that choice.
And that's what I find so interesting is we've had this, we provide this amazing experience, but also recognizing we want to keep everyone safe, right? So I want my 35-year-old who maybe we're dealing with blood pressure issues, or we're dealing with diabetes, to still be able to have those special experiences that my low risk 22, 23-year-old is having. It might look a little bit different, but I want her to have those feelings similar to that low risk patient.
That's a really great way to put it. So let's talk a little bit about some things that, going back to staying in control, some things that women are doing to take a little bit of their reproduction into their control. So what are some ways to preserve fertility?
Right. So the things that come to mind, if we're thinking like long-term preservation of fertility, we can, if you have a partner, or in order to make a baby, we need a couple things. So we need eggs, and we need sperm, and we need a place for when those two come together for the embryo to go, right? So if I am someone who has one of those things, the eggs, or maybe two of the things, the eggs and the uterus that I need, your uterus is going to be able to, your uterus is an amazing, we could have a whole video on how amazing your uterus is.
Let's talk your uterus.
It starts out it's so little, and then it holds humans, and then it's so, as much as we rail against our uteruses, sometimes it is pretty amazing. But so if we have eggs and we're not ready to make a baby or start a pregnancy just yet, we can do we don't, at a reproductive endocrinology and infertility healthcare facility, you can freeze eggs. That is a very reasonable thing to do. If you have both the eggs and the sperm available, even doing IVF, in vitro fertilization, with the idea of creating embryos, and those can also be cryopreserved or frozen, and then timing out when you want to utilize those embryos or those eggs. So when we talk about one of the concerns as we get older from a genetic standpoint, a 40-year-old using 34-year-old eggs, those risks of genetic issues are for a 34-year-old, not a 40-year-old.
That's really fascinating. Yeah,
I was just going to say, a lot of people, it's just kind of also good to know where you're sitting, right? So if you're like a 34-year-old and want to know where you're sitting, that's a whole nother, where is my fertility right now?
Sure.
And maybe that could play a role, instead of doing, once again, your reproductive life plan. Planning at 38, but based on my fertility evaluation right now, maybe now's the time. That's something you also have to be thinking of. Yeah.
Um, I was gonna say, oh gosh, what was it? I lost it real quick. Um, oh yes, okay. So it sounds like with egg freezing, you can do
Mhm.
fertilized eggs
Mhm.
and unfertilized eggs. So there's a couple
Yep.
of different ways that you can do this. What would happen if you froze unfertilized eggs? Like let's say that you know have
Right.
one of the factors that we were talking about and you're just thinking
Mhm.
about family planning in the
Right.
future.
Absolutely. So typically when in vitro fertilization or that process of collecting eggs, because of the process, we don't want to collect one egg or one
Mm-hmm.
oocyte, which is the fancy word for eggs, oocyte. We want to collect multiple. So if that is what we wanted to do, then medications are given to help uh, aggregate or bring together,
Mm-hmm.
5, 10, 15, 20 eggs, and then they would be retrieved. And then they would cryopreserve or freeze them for as long as you wanted to, as
Mm-hmm.
long as you want to store them. And then the same idea would be with if you had the sperm available that you would want to use, making those embryos and freezing them also. These are with reproductive technology, it's just really important if someone's thinking about that is making sure knowledge is power, as we've said, working with getting that consultation to talk to an REI specialist, reproductive endocrinology or infertility specialist, because I think I'm pretty darn smart, but they're much brighter than me about what
Right.
they're offering right now and what outcomes make the most sense for that person. Yeah.
Gotcha.
So I know, yeah, I have patients who are oftentimes a little leery about meeting with an REI specialist, and we have those locally. We have them up in the Twin Cities, Wisconsin, Iowa, wherever. But just even a consultation to understand, okay, this makes sense for me, and knowing it doesn't mean I think people think it's like test driving a car where you're like, but I don't want to test drive it because then I have to buy it. You don't have to buy it. You don't have to, you don't have to buy it. So if you go there, it's like it's going to cost $700,000, and I don't know. No, you do your consultation. A lot of these fertility specialists are doing telehealth visits, so you can do it at your house, and just kind of put together a really good plan. If we need to go beyond seeing one of us general women's healthcare
Mm-hmm.
clinicians.
Talking
Mm-hmm.
about reproductive endocrinologists and these sorts of things kind
Mm-hmm.
of leads into the question of infertility. And as
Mm-hmm.
you know, you're past that age of 35, and you know, trying to start your family, and things aren't going as smoothly as you might have wanted them to. When should somebody consider an infertility evaluation?
That's an awesome question. Um, let's back up for a second. If you're planning on thinking about making a baby between the next 1 to, let's even say, 5 years,
Mm-hmm.
it's a great time to meet with a women's health clinician to do like a pre-pregnancy planning visit, because
Mm-hmm.
then we can ask questions like, oh, what are your periods like? And you're like, yep, I have a period every month. And we put that in the back of our mind. We're like, oh, that sounds like she has regular ovulation. Now, on the
Mm-hmm.
flip side, the patient's like, yeah, I have periods like every 6 to 7 weeks. And I have a lot of issues with like acne and hair growth. And
Mm-hmm.
gosh, my periods are super heavy. I am locking that in as like, ooh, we might have an ovulatory issue here that's going to
Mm-hmm.
play a role in her ability to get pregnant. And she's not, we haven't even started that process yet.
Mm-hmm.
Or on the flip side, like, looking at when we think of structure of the uterus, like any history of sexually transmitted diseases or pelvic surgeries, infections, and oh no, none. And I'm like, okay, fallopian tubes should probably be open.
Mm-hmm.
Um, but if she's like, oh, I didn't know I had untreated gonorrhea or chlamydia for a while, then I start thinking about those
Mm-hmm.
fallopian tubes. So it sounds goofy,
Mm-hmm.
but even like backing up, if you have that opportunity, really recommend that.
Mm-hmm.
And even male factor infertility, people don't think about this, but in partners, about 40, maybe even up to 50% of fertility issues are male factor due to confirm. So understanding his history too. Okay. So whatever we did that. We didn't do that. That's fine. When should you make that step? So after age 35, for someone who's making the assumption that she's having periods about every 28 days, from the first day of her period to the next first day, about every 28 days, they're having sex according to whatever app they downloaded with little hearts. I will tell you tricks to that.
Yes.
If you subtract 14 days from whenever your period is, that's where the heart is, because you ovulate around 14 days before your period. If you're having sex around that time, with regular periods, and 6 months. So if you've attempted over 6 months, that qualifies for someone after age 35 as having fertility issues or fertility concerns and warrants a workup. Before age 35, we'll say like a year. Okay. But a big thing to keep in mind is that those regular periods, I oftentimes see that with patients who said, I didn't have any problem getting pregnant the first time. Was that a planned pregnancy? Oh no, that was like a real whoopsies. And then she says, oh, my periods are every, 7, 8 weeks. I don't know. Well, I know what the issue is there. And you've been trying to become pregnant the last 3 years. I could have assisted with that a long time ago, but you don't know what you don't know.
Exactly. Yeah. So, these are some good benchmarks to look out for after age 35 with, what we would consider a normal period, 6 months before age 35, a year. And it's always good to talk with your care provider to say, hey, we're going to wait, we're thinking about starting starting a family, having a baby, making a baby. So you guys can be cohesive in how you approach it together. Yeah,
absolutely. And I would just, as a caution, you can always come in sooner. You can always come in sooner. Please come in sooner. Like if you have concerns, like make the appointment. You don't have to try for 6 months. You can always make that appointment sooner. It's just after 6 months, I'm like, you want to come in?
Come on in. Yeah, it's so good to hear. It's so good to hear that. It's so good to hear that, because sometimes, people might be really like, oh, I don't want to go in if it's nothing, or if it's, I don't want to go in and for whatever, and to have a healthcare provider saying, nope, come to me. I want to help you. That's really encouraging. So thanks for mentioning that. But, we've answered kind of all of the questions that we had been presented on Instagram, and heard a lot of really great information about age and fertility. And like a lot of our videos, and we really encourage you to visit with your primary care. Call Olmsted Medical Center, Obstetrics and Gynecology, and get an inpatient exam. Get matched up with OBGYN there. They're fantastic. And they just, they want to help you on your health journey. And if you have any questions, we're going to post an article that is really helpful in answering a lot of these questions, that we've been talking about age and fertility, in the comments below. If you have any follow-up questions, please send a message. I know things can be a little sensitive, and we will make sure that Dr. Richards sees those. But Dr. Richards, do you have anything else that you wanted to add to this conversation about age and fertility before we wrap up?
I've got nothing that I can think of offhand. I'm always doing plugs based on the time that we're living through. I can't forget that we are living through a pandemic, and there are always lots of questions about fertility and COVID and the COVID vaccine. Please, please, please utilize strong sources like the American College of Obstetricians and Gynecologists. The Society for Reproductive Medicine has great information about COVID, the vaccine, how we feel about it with fertility. Feel free to reach out to us. I feel like I'm the hall monitor with COVID, and we need to keep talking about it, but it's just really important to feel like you can ask those questions in a non-judgmental way, that you can get that information that you need.
Great. Thank you for adding that in, because we cannot let that topic, trickle out. So nope, gotta keep going. Thank you so much for your time today. Thank you to the viewers for tuning into this Let's Talk conversation, and we wish you the very best day. Bye-bye.
Bye. Thank you.